pedals to minimize hand exposure. There has to be a decent labeling of the waste. It has to be clear, understandable, it has to be in bold letters, easily seen. So all of those characteristics. So do not mix up the waste. You have to learn how to identify a trace hazardous waste that is usually put into the waste bag, which is double bag, and the bulk hazardous waste in the chemotherapy waste container, which is made up of a very tough material, just like your sharps container. It has to be collected separately at the point of origin, okay? And the waste must be firmly closed and provided for in-house transport to collection points for removal and incineration. So here we have the hierarchy of controls. So it's not actually possible to employ the highest, which is elimination, because we cannot actually completely remove the hazard. So the highest control I think that we can apply is the substitution by replacing that hazardous drugs with a less hazardous ones, but that depends on the patient's condition, diagnosis, and of course the doctor's call. So, but what we can actually implement consistently is the engineering controls. That's why there's that bulk discussion regarding that. Okay, wherein we can isolate the workers from the hazard. So we have your primary, the secondary, and the adjunct control. Then we have the administrative control, changing our attitudes, and of course implementing new policies. And of course, the least effective would be the use of the PPEs, because there's still a tendency to become defective and for it to have some leakages and perforations. So the take-home messages, so medication error is one of the biggest risks that compromise the safety of the patient undergoing chemotherapy. Training is instrumental in significantly reducing the risk of chemical exposure of healthcare professionals, and in the institutions must strive as much as possible to observe the highest control measures in the prevention of chemical hazards. So there are hazards in everything one does, but there are greater hazards in doing nothing. So thank you for listening to this short discussion on augmenting safety in hazardous drug handling.